Mimi nakuanga na virusi ya HIV.
Wakati nilijua hiyo story, ni wakati nilikuwa na mimba ya mtoto wangu second born.
Lakini wote wawili ni negative.
Nikamuuliza kwa inaweza kuwa hivyo? Yeye ni positive na niko negative.
Nilianza matibabu, hata tukiwa pamoja huwezi sema ati ni mtu ako positive na mwingine negative.
My parent passed on when I was very young, in class 2. I didn't know what really was happening because I was around 7 years old. The moment I was told I'm HIV positive, I asked the nurse who was talking to me, I asked her, how comes? I've never done those immoral things. I've never been sexually involved with somebody. What is happening? Now they had to explain there is this transmission of mother to child. The next thing I saw was death. I didn't see future. I didn't see as if I'm going to be where I am today. I saw the end of me.
Nilienda kliniki kama niko mjamzito. Ndio daktari alichukua damu yetu sisi wote akapima. Kupima damu yetu ndio sasa ilitokea mimi natoka positive, mzee na anatoka negative. Na nikaambiwa huyu mtoto vile ataanguka chini, tuko na dawa ile tutakupatia ya kuzuia mtoto asipate virusi kutoka kwako. Mtoto akakuja kupimwa akapatikana ako negative. Vile nilipata mtoto wa pili akakuwa HIV negative. Tena Mungu akanibariki na mtoto wa tatu ambaye sasa niko naye kwa saa hii ako sasa miaka 2, tena ako HIV negative.
Mungu awabariki. Juu kupeza kupatikana ni shida. Sasa wangesema ati tununue dawa, sijui kama tunaweza pata pesa.
If it wasn't for CHS, then I don't think I would be where I am today.
Sijui hata ningekuwa wapi. Saa zingine ningekuwa nimekufa ama saa zingine ningekuwa nimezaa mtoto positive.
TEGEMEZA Project is a project funded by the US government through Centers for Disease Control and Prevention, which is CDC. So CHS was an applicant in 2011. We took the theme of sustainability and initiating some sustainable approaches and innovations in the programming for the project.
The focus is to implement and expand high-quality HIV prevention, care and treatment services in Central Kenya, previously Central Province, but now in 5 counties of Central Kenya. That's Kiambu, Laikipia, Murang'a, Nyeri, and Nyandarua.
Health is multidisciplinary. Several people come together to make a patient get better. Remember, initial access was an issue. Our people could not access healthcare. In 2013, our prevalence for HIV was at 3.7%. Out of every 100 people, close to 4 were HIV positive in Laikipia County. But through the efforts of government and other partners, we are trying to remedy that.
We have had a good increase in terms of the numbers we've been able to identify through the support of what we call the HIV testing service providers. And we've been able also to get a very good, better outcomes when it comes to the clients who are already on care. We've been able to get better quality of care, and therefore we've been able even to see very good virus suppression rates as a result of the quality of care that we've been providing through their support.
CHS has supported more Laikipians to live positively, has assisted more Laikipians who are HIV positive to access care, to access the right drugs, has assisted children who could have gotten the virus from their mothers not to get the virus. So that eventually is contributing to what we call as quality and better healthcare for our people.
In the last county profile, we were mentioned to be one of the counties that we have reduced our infections from the previous year 4.3, our prevalence, to 3.4.
The other key objective was to support prevention of mother-to-child transmission of HIV services, and we've been able to provide support to close to 8,000 ARVs to close to 8,000 women living with HIV, and also prevention services to their infants.
We have been able to reduce the infections of infants that previously we started from all the way from 5.2, and now we are approximately at 2.8.
Nilikuwa nimekuja nikiwa mjamzito, ndio nikapimwa hali yangu na nikajikuta niko positive. Kutokana na hapo nilipata mashauri ama mawaidha, mtoto alikuwa HIV negative free.
The major challenge that we've had in the last few years is human resource. We are dealing with facilities that are being manned by either one nurse in some instances, and in some areas facilities are closed because we do not have the requisite human resource.
Kenya has a lower ratio of healthcare workers to population, and so our intervention to increase the number of healthcare providers has supported this, but it just shows that it remains a challenge that we do not have enough healthcare workers to serve the population.
Human resource, initially it was a big issue by virtue of the fact that most of the time the government was not able to really give the facilities the adequate number of persons or personnel that are required for the service delivery.
Quality care depends on quality health workers. Quality care depends on the right number of health workers. And quality care depends on having that health worker at the right time. So if they are not there, then people will not access also healthcare. Through that support with CHS, we have partnered and managed to increase our human workforce. They recruited for us. Initially, there were 13 health workers. Then once the county took them over, they again recruited another 15. And they are high-quality health workers who are well-trained, who are well-versed in the HIV field. That ensures that we provide quality care to our patients.
CHS came in very handy in terms of supporting extra staffs who, lucky enough, they were the cadres that were required when it comes to quality service delivery.
They provided support of training. Due to that training, they were able to manage the patients well.
You are taken for seminars, so you know, or workshops, you know how to treat a condition when it comes. You know how to deal with clients, how they come. You know how to talk to clients so that they can adhere to treatment. You know how to diagnose a condition, you see? Rather than you come immediately from school and then you don't know how to deal with the condition.
They allow the county government through the Public Service Board to recruit their staff. And then as a county, we've been able to observe the staffs that have been handed over from CHS upon completion of their contracts.
They also trained peer mentors. You know, as I talk to my peer, it's easier for them to get from me than from an adult. That one is really working with the adolescents because they see if this is a young person, they have achieved and they are positive, I can also make it.
You realize that from this project we have supported over about 240 plus staff added to the county health workforce each year.
TEGEMEZA iliweza kutusaidia. Jambo la kwanza katika grupu yangu ina pia counselors wawili, watatu, pia educator watatu. Na hao watu watatu wametrain PWP, wametrain pia educator.
Before the CHS came, you would find that you are here in the hospital but you feel like nobody understands you, nobody knows what you are going through. But now when they came in, they brought a more friendly center where somebody is able to speak out, to able to say this and this is not going right for me.
Vile nilikuwa nimefuatilia clinic na nilikuwa mama mzuri ama client mzuri, nilipata nafasi ya kualikwa na nikafanya interview na nikachukuliwa kama mentor mother.
The records help clinicians to make informed decisions on how to improve the care of the patient. Without the records, we will not be able to know whether we are on the right track.
We've been able to review many of our services in terms of the data that we have, and as a result of that, we've been able to come up with key or very nice best practices.
Most of them have been trained on how to go about the data so that we don't have to have the papers throughout.
We have, supported e-learning equipment. We provided e-learning equipment to about 13 health facilities. But also we've supported quite a few of, these 13 facilities to be able to participate in, international courses. For instance, the University of Washington has some advanced HIV learning courses that they offer through an e-learning platform. They also have some training on leadership and management, on research. So we've been able to link these facilities to learning, outside of beyond our borders. We were also mandated to support M&E systems, monitoring and evaluations, and health management information systems. We have supported this in all the supported facilities, close to 191 facilities at the beginning of the project, and supported the electronic medical records EMR system in 67 facilities. So we're able to expand EMR services to all the care and treatment facilities.
Through that EMR, we have been able to be more accurate and more prompt when it comes to action taking concerning the client.
We have also provided them with tools to manage data. So sometimes provided them with registers, data capture tools. We provided computers to many of these facilities, and this helps us to actually be able to track, the performance of a patient, look at what the data about these patients is telling us where we need to improve and others.
Through supportive supervision, training and the likes, I've been able to get where I am as a health record officer and been able to give accurate information as required by the rest of the team.
Access to medical products and technologies is very important for patients, because you do not want to disrupt treatment of a patient who is already on HIV drugs. So continuous supply and also accessibility of those drugs to the patients, it's very important. Drug management was a challenge before this program came on board. We had problems with storage, transport to some of our satellite sites. We were able to take the drugs to where the patients can easily access them. And also when it came to dispensing, we were able to keep proper records, which is also very important when it comes to management of patients.
Which has ensured that patients are able to get good quality medicines in the hospital and in the rest of the county.
CHS has been very key in supporting us with the commodities.
They have provided us with some equipment so that we are able to test even the CD4s, the gene experts, the AFBs and viral loads.
Prior to 2012, we had a problem with our CCC. It had leaking roofs. The waiting bay had not been constructed, so the patient used to train up in the grasses, and that affected because so many patients were fearing to come into the CCC.
Hatukuwa na sink ya kuosha mikono after seeing our clients, na kila jioni tulikuwa tunakusanya kila kitu tunapeleka kwa room moja. It was hectic and tiresome.
There were no shops. Drugs used to expire very fast because they were used to be kept on the floor.
Back then, we used to have a small room where we used to see all our clients. Whether you are coming for HIV drugs or you're coming for TB clinic, our clients became mostly co-infected. At one point, I also got TB since the room was congested and there was no enough ventilation.
We used to attend our clients in outpatient department, so we didn't have a place for our clients. And due to the stigma, most of the patients were not able to access the services.
Hospitals and health centers, dispensaries require additional space for the services that were required. So for example, for HIV testing services, it requires privacy, confidentiality, and those become important things to think about when you're looking at health infrastructure.
Many facilities did not have HIV services in their plan, even when they were designed. So for instance, you'll find that maybe, TB clinics are a little corner somewhere. HIV services did not have anything. And really, you really have to work on improving the environment for service delivery.
Lakini kwa sasa, venye CHS walikuja wakatujengea nyumba, the rooms are good, kuna privacy, and the flow of clients imekuja juu.
When this program came, we were supported with storage. One of our store was renovated.
We have done infrastructure investments that are sustainable because they remain in these health facilities. Investing about 56 million shillings in infrastructure investments at different health facilities, which will continue to serve the community in the foreseeable future.
The HIV program in Nyahururu is supported through CHS to a tune of close to 10 million every year. The 10 million is specifically to pay the health workers, to assist in specimen transportation, assist in support supervision, and assist in communication within the facility and outside the facility.
Like my office, they support me with communication. I'm supported monthly basis. The leadership is also supported, the director, the administrator, the human resource person. Yeah.
We have seen CHS grow from a small organization now to a very big organization, and we do recognize their role in HIV control. Of course, at a national level, CHS partners with us in HIV programming at the technical level. CHS is a key member of the different technical working groups at the national level and hosted here at NASCOP.
CHS is the one that helped us most as far as the county AIDS strategic plan is concerned. I've seen a partner who is willing to work with you, participating. When I come to the level of the county, I can't point a finger, whereby I'm disappointed by CHS, simply because they involve themselves. When you call upon them, they don't delay. They have answers to the questions that we ask.
CHS is a worthy partner. CHS is a partner anybody would wish to work with at any time.
And of course, we look at CHS to continue technically contributing to the national program through the different technical working groups. And we look forward to CHS actually investing much more in scientific evidence generation through research by documentation of best practices within those areas where they're working. And that in turn feeds into the national program in form of policy formulation and action.
It's through the generous support of the American people for their continued support and funding to ensure that we can achieve the objectives of the TEGEMEZA project. Also, the Ministry of Health in Kenya, it's under the auspices of the Ministry of Health that we have the current infrastructure to provide services to patients.
Thank you for the work that they have done.
CHS ni usaidizi wangu.
I'm very grateful and thank you for what you've done for us, the youths and the adolescents. You've really been supportive, ensuring that we take our medication properly in the right way, giving us education on how we are supposed to manage our condition. They are also there to guide us on matters pertaining life, and they encourage us in whichever situation.
Tulifurahi sana.
Mpaka tukasema
kweli mmefanya kazi nzuri kwa kutuletea hii mandawa. Kama sio mandawa hiyo tungekuwa tumekufa tayari, lakini sasa tuko uhai.
Tungewaombea Mungu wakae hapa kwetu tupate shindano ya kupona, kwa kuwa walilete watoto wetu wana na sisi tunaye. Hivyo walifanya ya mtoto ikapatikana, hata sisi tunaomba watuletee. Mungu awabariki zaidi, awape uerevu wapate ya kupona.